歡迎大家今日嚟到我哋李嘉誠醫學院啦。I have been instructed that this session is going to be conducted in English, so I will say, as our MC said, a few words. Okay, first, really to welcome all of you to come to this Faculty of Medicine. I am a clinician, and in fact, but it is good to see so many of you actually wanting to find out about our pharmacy program. Just to tell you a little bit about myself, I am a clinician and I'm what we call a rheumatologist, someone who looks after people with joint pain, arthritis, etc., etc. And arthritis that is actually related to the immune changes inside the body so that the immune cells actually attack the patient's own joints or different organs, causing a lot of problems. When I started my training in rheumatology, there was really not anything that I could offer my patients. But over the last 30 plus years, there has been a lot of advances in the development of immunology, and most importantly, how we had used our knowledge in immunology to turn it into medicines to help our patients. All this actually, of course, has got to do with pharmacy, understanding of the body, understanding how we can correct what has gone wrong in the body, and understanding the mechanism of action of a medicine, how it actually goes into the system, how it actually, and how we then get rid of it, etc., etc. So pharmacy is a very, very important discipline. And in fact, before I started studying medicine, I nearly went into pharmacy. I am a graduate from Scotland. I studied medicine in the University of Dundee, but before I actually got admitted by the University of Dundee Medicine faculty, I was actually offered a place at the London School of Pharmacy. I think many of my colleagues did not know that actually. So I actually joined the medical profession instead of the pharmacy profession. Not that I'm telling you now, I regretted the decision, but to be honest, had I actually not gone into medicine and had I gone into the London School of Pharmacy, I believe that actually I will also have been able to contribute to the well-being of our patients just the same. So within the Faculty of Medicine, we have 5 schools and 1 department, and we actually train people to do medicine, we train people to do nursing, we train people to conduct research, we train people to look at the world at large, global health, and we train people to become pharmacists. And all of these are very much related to enhancing the well-being and the health of our people, not just in Hong Kong, but the rest of the world. And we all work together. Okay, so although we have separate schools, although we have separate programs, our teachers interact with each other very frequently at sort of research level, at teaching and learning level, as well as looking after students. So I can assure you that, okay, if you intend to study pharmacy, this is the place that you want to come. This is the place where you will learn how to use different medications to improve the patients. This is a place where you will get the best of support. And this is the place that we will use the most advanced technologies to help students actually understand mechanism of drugs, etc. And there will be much more to tell you later on, and I will leave that to my colleague from the pharmacy department. So with that, I welcome you once again, and I thank you once again for coming to this talk. This is rather sort of a conventional, traditional, sort of a classroom type of talk. And after this, I believe that there will be more one-on-one, interactive question and answer sessions. So do save up all your questions and ask, okay, all of our teachers later on. So welcome again. Thank you.
Hey, good morning, teachers and prospective students. My name is Eliza Tam. I'm from the Department of Pharmacology and Pharmacy. I'm one of the teachers from the department, and I'm also a pharmacist in Hong Kong. So welcome once again to our lovely campus. And I believe it's typhoon free now, so please stay here and it will be a safe place for you to stay. Okay, so we have the introduction to pharmacy and the role of pharmacists in Hong Kong. Some of you may not be aware of our latest role, particularly in the primary healthcare initiative. Secondly, we will talk about unique features of the HKU BPharm curriculum. Perhaps you are thinking to study in pharmacy and deciding where to go. So I would like to share with you some of the features at HKU that why you should choose us. Number 3 is our department support to our students. And number 4, perhaps would be the most interactive part, is the admission requirement. After that, we will have our student sharing. So we're happy to have our students here. Also, we have our alumni here as well. So if there's any question you want to learn more about student life in HKU, that will be the session that you hopefully you will stay with us. So the role of pharmacists. Pharmacists are healthcare professional expert in medicines. We are very proud to be in the interdisciplinary team, supporting the decision of clinicians and also supporting other healthcare professional at hospital setting and also outside of hospital settings. We practice in hospital, clinics, community pharmacy. There's a lot of NGO pharmacy that's been opened now in the past year, which I will share with you some of the news a bit later on. Pharmaceutical companies, Department of Health, and drug office. So we have a spectrum of students who will enroll in our program. Some of them, they might not be they are quite shy when they join our program, and they would want to be a bit more research-based or in regulatory basis. So there are a spectrum of career that students can go into, apart from, frontline in the hospital or community pharmacy. So I'd like to share with you our degree. It's a professional degree, but with diverse job opportunities. So you can either go into academia, research. I was a frontline pharmacist before I joined the department to become a teacher. So there might be switching of different roles in your career path. You can be joining a pharmaceutical industry, doing research and development into new drug development. As our dean has mentioned, there's a lot of new drug that's been on the market. There's probably 1 or 2 every day with immunotherapy, etc. So there's a lot of new things to learn and a lot of things that you can contribute in the making of new drugs. There are hospital pharmacists, which I think most of you would know. I've seen one before at the hospital. So they are the one giving you counseling of drugs. There are extended services in the hospital too, where pharmacists can contribute to the care of patients. Again, Department of Health also have pharmacists who regulate drug registry in Hong Kong. They will regulate the safety of drug use in Hong Kong as well. So there are opportunities there for pharmacists. And lastly, there are community pharmacy as well. So there are chain pharmacy that you can work in. And also there's a lot of new development of primary healthcare pharmacists that you can be part of the interdisciplinary team. So I'd like to talk a bit more about the role of pharmacists in primary healthcare. So this is a new role for pharmacists in the past 2-3 years and upcoming years as we foresee. So the traditional of pharmacists in community pharmacy, we manage people by responding to their symptoms, dispensing prescription, doing drug counseling, etc. But we are going to take on the new roles of health promotion, disease prevention, and I think the most important part is patient empowerment. I often say to my students that, you can give the best drugs to your patient, but if they don't understand the treatment, they don't understand the benefit it will bring to them, there's no use to your patient. They will just put it away at home. So patient empowerment, it's a very big issue in the society, and also self-care as well. So you are a healthcare professional who face the patient, say in 10 minutes, 30 minutes, but they have to take care of themselves. They have to understand their disease state as well. So the primary healthcare initiative, it's really shifting the focus to the community. So I think we're very used to going to the hospital and get healthcare, but really there's a lot of prevention and screening and management of chronic diseases that can happen in the community level. So we will be seeing that happening in the next few years. And it is one of the government initiatives that they wanted to do this. So next, I want to talk about our program. So if you're thinking about pharmacy as one of your choices, why would you want to choose us and what's our features? So just a bit of background about our program. So we are launched in 2009 and we are accredited by the Hong Kong Pharmacy and Poisons Board. So all the students who are graduated with us, once you pass 1 year internship experience, then you will be automatically obtain a license in Hong Kong. So this is all for all graduates in Hong Kong. So 1 year postgraduate training, you pass the components, satisfied that you are competent, you automatically get the license in Hong Kong. It's a 4-year program, and our intake has been about 35 to 40, but we are not limited to 40. So if we see good candidates, we can admit a bit more than 40 as well. We are very proud that we have a lot of learning spaces for our students. So not only within the campus, we have a lot of external collaborator and teaching sites for our students as well. So we're very proud to have authentic learning experience at our exclusive pharmacy teaching sites. Number one is the clinical hospital. So they are exclusive for our students training. We have teaching practitioners. So they are teachers who teach here and also practice at GHK as well. So they will lead our students to practice at teaching sites. So our belief is that you learn your knowledge in university, but you also need to practice and apply to obtain that knowledge. So this is why we have a very diverse side for our students to practice. So number one, it's the GHK, where we send our students to practice. We also help to set up some community pharmacy as well. So before the primary healthcare blueprint came out and we set up all the other community pharmacy, this is the first one probably in Hong Kong that was a collaboration with an NGO. So the organization is called Health in Action, 醫護行者. And we set up a pharmacy collaborated with them at Kwai Chung. Mainly, we serve the minority groups that are using the services and also people at work. So if you have been to community pharmacy, most of them will close at 7. It's not very practical for those who are at work wanted to seek advice from pharmacy. So this pharmacy actually open after hours as well, hopefully to serve the community that's in need. So that was one that we set up, and it's an exclusive community practice site for our students too. We also set up another community pharmacy in Aberdeen. So this is the Aberdeen Community Kai Fong Association, and we set up a community pharmacy there to train our students. And so this is a teaching site for our students as well. And all these 2 pharmacy that we set up, we actually set it up in 2018 and 2019. So it was way before the time that this new healthcare initiative came on. Lately, and this is something new for us and very exclusive to our students, we actually set up a community pharmacy at Sashim Road. So if you are traveling and visiting our campus today, welcome to come to our pharmacy. It's not officially open yet, but it's there. So even if you don't join our program, but if you join our Hong Kong UMed family, you're welcome to use the services there when you are a student, a staff, or just someone walking by. This is an educational training site for our students. So we are not having a simulated environment for students. We have authentic on-site teaching site for our students. So not only pharmacy students will train here, we plan to use this site for interdisciplinary training as well. So students from other disciplines can also train with pharmacy students. And we are supported by the health services clinic next door as well. So we work very closely with the doctors there to provide services to our staff and also to our students as well. So feel free to come and visit today. We actually have some tour. If you want to see the pharmacy inside, you're welcome to come and have a look. So apart from our internal partners, we have training with our external partners as well. So the photo on the left-hand side are training sites at Queen Mary Hospital, which is one of our teaching hospital that we train our students in. We have collaboration with chain pharmacy like Watsons and Mannings, and we have long-term collaboration with them to train our students. And also with DHC, so the District Health Center, we also send our students there to practice as well. Secondly, we want to train our students for future role of pharmacist. So our vision is not just training our students for today. We wanted to train our students for the future as well. So we actually will adopt overseas model. We wanted to see what overseas pharmacists can do, and hopefully one day we can bring those services or initiative into Hong Kong. One of them was the vaccination by pharmacists. So if you know the UK model, Australia model, they have pharmacists doing vaccinations in community pharmacy in the overseas setting. So at Hong Kong U, we adopted this into our curriculum. So all students at our BPharm level, they are trained to be vaccinators. So once they graduated and be competent in vaccination, they one day when we can do vaccination, they are ready to do it. So this is our vision. We don't want to train someone just competent today. We want to train someone who's competent to accept new challenges. So this is why we have our pharmacy experiential education program. In short, we call it PEEP. Every year, our students are exposed to different learning initiatives to learn more about pharmacy and be involved with our profession. So year one will be more an observation and discussion with our alumni and also with different pharmacists from different sectors. So we invite people from the industry, from the hospital to come and do some sharing with our students so they can get to understand more about what we do. A lot of year one students from other school and other discipline will say, in year one, I do a lot of science-based subjects. I don't know about my profession. And this is exactly why we put it there. We want the students to feel that they are part of our family, even from year one. Year 2 and 3 are very comprehensive year and very knowledge packed, but we actually were able to free up one day a week. Students will go outside and work. Okay, so they will not just observe, they will be part of the team in a community pharmacy, NGO pharmacy, hospital pharmacy, and they actually work there as part of the team. So the idea for that is we hope that they can be part in the workforce to learn about the different cultures and also to use what they learn in school and apply to the workplace. And this, we want to build this in very, very early. So one of the examples that I had is because I teach diabetes. And one day I was telling the students how expensive the new machines are. And one of the students put her hand up and say, oh, I've seen it in the chain store. It's over $1,000. It's very hard for patients to afford it. And this just immediately built into their mind. So if I say that in lecture that, oh, the machine's very expensive, you got to think about patient acceptability, they will forget it the next day. But if they've seen it in real life, they understand the patient's challenges. This is something that they can build into their career and they will remember that for life. So we're very proud of this because we are probably the only school that can afford to do this, partly because of the small class size. And also we really take on the initiative to let our students to have those experience outside of school. Year 4 is a little different. So year 4, we have 2 different experiential learning programs. Number 1 is what we call a clerkship. So students will go to 3 different sectors that our pharmacists usually practice. So hospital, community, industry. They will spend whole 2 weeks at the site and follow a pharmacist and see what they do there. We put that strategically in year 4, so students can consider what sort of career path that they want after they graduated. So this is why we put it later in the year. They've learned most of the therapeutics and all the drugs, and they can sort of think about what they want in their career life. The enrichment program is very different to what I've just mentioned in the previous year. In enrichment, students actually practice at a non-pharmacy site. So we want them to experience the world. We want them to know the challenges of different citizens. And we want them to bring this empathy and also what they learn into the community as well. So they are not just receiver of education, they can contribute to the society as well. So this is why we put it in year 4, just before they graduated. So enrichment program, it's understanding what our society needs. So I mentioned that they don't need to work in a community sector. So the places that they work is very diverse. So we have students working in NGO giving educational talks. We have students who went to a pastry NGO shop, 糕點時光, it's called. So they actually support elderly women and people and women who want to go back to their workforce to make traditional pastry and promote this, you can still work as a single mom or as an elderly retired woman. So one of the students went to support that that initiative. The one on the left-hand side is a student who went to a NGO that promotes safe sex. So it was a talk that he was giving to domestic workers because a lot of them have no knowledge about safe sex, and if they, they get diseases from having unprotected sex as well. So that's one of the places that students can go to. At Hong Kong UMed, we're also very proud to have interprofessional education. So we pull in different disciplines. So there's about 7 different disciplines in our school. We also have social workers, physiotherapy into the care of patients. So we wanted to mimic what happens in the real workplace, because you don't work alone. So even if you're doctors, nurses, you work in a disciplinary team. So we want students to know this and learn how to collaborate with each other very early in their career. So in year 2, year 3, year 4, students will get into groups with different disciplines, and they will discuss a patient case and how to manage a case. So this is one of the events that we've hosted few years ago, where students will sit in circles, and then we will have teachers to explain on the cases, and they will present on their findings as well. And it's a great learning opportunity that you get to meet other students from the school, and also get to know each other too. So we don't just want to train competent pharmacists today. We wanted to train what future needs, and also future researchers as well. So we've had alumni who will pursue their academic studies into further studies. So they might go into master, they might go into PhD studies, hopefully to contribute the drug development worldwide. So the picture in the middle, it's one of our alumni. He was graduated in 2012, and now he works at UCL. So he's actually working as, I think, an assistant professor there at UCL. Our department actually contribute a lot to research as well. So if you remember COVID times, there's a safety, vaccine safety monitoring, and it was actually an initiative taken by our department. And Professor Im Wong, who is on the screen there, he's one of the leading investigator into the project. So he would actually give advice to the government on vaccine safety and what to do with vaccines. So not only we are very strong in our teaching, we're very strong in our research as well to inform policy and to change policy too. And something exciting for the students is summer exchange opportunity. So we encourage students to go to exchange, overseas exchange once in their 4-year curriculum. We see dramatic changes for students going overseas because they will need to be independent. They can't call their parents for help, so they need to solve the problem on their own. They also get to learn different cultures. They also get to meet different students from different backgrounds as well. And it's a great opportunity. And we've actually set up a lot of collaboration with overseas university. So the exchange usually goes for at least 1 month to 3 months. So students get to choose where to go and how long they want this exposure to be. So it's a really good opportunity for them to know that the world is very big. It's just not narrow in Hong Kong. They can explore different areas. So next, I'm going to talk about our department support to our students. So our staff diversity are very huge. So we have locally trained pharmacists and staff. We have overseas trained pharmacists as well. So for example, I was trained in Sydney, but I was born in Hong Kong. So, and my master was in Hong Kong too. So there's a diverse knowledge from overseas practice to local practice. And, that happens to most of my colleagues. So they might be trained overseas, come back, they might train locally or has exposed, their postgraduate studies overseas. So we hope to bring all this in to benefit our program. We also have what we call teaching practitioners as well. So traditionally, teachers are teachers. So, they only base in work or the academic area. But we started this last year that we want our teachers to be most up to date to what's happening, outside as well. So we have 6 pharmacists who works in the community base. So they work partly in the community. They come back to teach our students as well. And we also have 2 of my other colleagues who work in Gleneagle. So they are hospital based. So they practice at hospital and they bring back that knowledge to our students. So that's quite unique to our department because we have both teaching-based teachers and also teaching practitioner to bring back the knowledge too. We also very proud to be having a small teacher-student ratio. So our admission number is about 35 to about 40, and we have a lot of academic staff. So I think I counted last was about 40 academic staff. So we have about 1-to-1 student ratio. So each of the students will be assigned to an academic advisor for 4 years. So in this 4 years, if you encounter any problems, you can go into your academic advisor and they can give you advice on what to do. If you feel more comfortable with a particular teacher, you can also approach them as well. I think we are very we're very close in our department. So, students can go to any teachers, raise their issues, and we will find a way to help them. We have a small teaching students ratio. So most of our class size, apart from lectures, are usually in groups of 5 to 6 students per teacher. So we actually can pick out problems very quickly if our students encounter any study difficulties, and we can help them immediately as well. So admission requirements. So perhaps this is something that you might be interested a bit more to know. So for the upcoming year, this actually hasn't changed. So it's still the best 6 subjects among category A subjects with attainment in citizenship and social development. These 6 subjects must be 4 core subjects plus 2 elective, and M1, M2 will be counted as 1 elective as well. Our admission will adopt the Hong Kong U scoring system, which I think you already know how that works. So we wanted to award the high achievers on, and congratulate on their, really hard study in DSE. So we will award them with a bit more points when they get 5 stars or 5 stars. So One of the requirement that might be different to other program is chemistry component. It's mandatory in our program. It can be combined with other science, so it can be chemistry or combined science with chemistry component. It's mainly for the benefit for students, because if you don't have chemistry component, you will find it very difficult to study our program, because a lot of the drugs are chemical based. So if you don't have a chemistry background, you might find it very difficult. So we make that a requirement for our admission program. You'll have a working level in Cantonese, mainly because you can see from our program, we have a lot of time that you will need to talk to the public. So you need to talk to patient, other colleagues, etc. And this will just help you to immerse in the environment. We have admission interviews as well. So you must having a satisfactory performance at our interview, and also meet the university entry requirement too. So that I think chemistry is probably one of the one that's unique to our program, probably a bit different to other discipline in the faculty. So the admission score for the upcoming admission exercise. So the expected score for DSE is at 35. This is with the Hong Kong U bonus score system. IB is 37, and the GCE level would be 3A star. Okay, and all those subjects must be a science-based subject. So the question would be, if I have the same score as my friend next to me, how would I be selected? So if there are a tiebreaker in those incidents, we will look at other areas that's apart from the score. So first, we will look at the interview performance. You will conduct 2 interviews with our interviewers. The interviewers are our teachers, so they will have a sense if you are, a suitable candidate for our program. So interview performance will be one, and then the level 7, level 8, category A subjects, the performance of those. Category C, and if you have principal nominations, we will take a look at those as well. But those, it's not a very usual thing that will happen. Usually, if you have the same score, if our program allows, we will admit you in as well. Yeah, so that's very last. If you are the last one and maybe the last one, then we will use this system to try to pick the candidate into our program. So these are the tentative interview dates. So for non-JUPAS candidate, the first round will be on the 2nd of January and the 3rd of January. So just after the Christmas and the New Year break, we will have those interviews for the first 2 days. For non-JUPAS candidates, because you can enroll or register on a rolling basis. So the second interview date in April are for the late registrant. So depending on how many candidates that we got, if you're a late registrant, we might or may not have that interview. So if you're interested, we encourage you to register early. For DSE candidates, the first interview date will be on the 20th of June. This will be before the announcement of the DSE results. And because you're allowed to change your subjects later on after the release of results, we will have another interview date on the 25th. So that's the dates that we have set for the interviews. So for interview, because we do get a lot of submissions for interview and applicants. So the priority will be given to those who put out Hong Kong U BPharm as the Band A choice or first choice. So we will prioritize those for the interviews. So you might be a bit concerned about, what to do in the interview. So our interview is actually very casual. We wanted to assess if a candidate is suitable for our program. That's all. So we have 2 different types of interview. One, it's an individual interview. One, it's a group interview. During those interviews, we actually assess different criteria. So we wanted to know the general knowledge of the students, their personal insights, and their language skills. So one question will be in Cantonese, one question will be in English. We also have a group interview because we wanted to see how you interact with each other as well. Because as I say, when you come out to work, you don't work alone, you work with other people. So we hope to see that you have the essential collaboration skill and the communication skill that you can work with each other. So we take the initiative to have this extensive interview. Hopefully that we will get a good match. You will want to come to us and we will think that you are a suitable candidate for our program too. So the information day today, so we have just one session now on the admission talk. We will have another admission talk in Cantonese in the afternoon. So for those who cannot join us, or if you wanted to hear us again in Cantonese, welcome to join us again later today. I think same in this room as well. We also have admission consultation. So as the Dean mentioned, we have one-on-one consultation. So if you have a particular question that you wanted to ask, maybe you're a repeater and wanted to ask how those points are calculated, you have some outstanding things that you wanted to discuss, feel free to come to us. So this is just, if you exit on this side, it's just the 2 rooms once you enter to the glass door. So we'll have our teachers and also students as well. So maybe the students wanted to know what happened to, when I joined the program, we invited some students to do sharing. So they will give you some very honest opinion. So don't worry, teachers won't be there. So it's just a student circle that you can discuss among yourself. So we have student circle. If you have something more to ask about our curriculum and also admission, feel free to come to us. So it's just in that room there. We also have different workshop demonstration and the community pharmacy visits as well. So I think it's in your prospectus or the schedule today. So just join us during those times. But I think registration for those are full already. But the pharmacy, feel free to come and walk around because it's just outside at the corridor as Free Sasha Road. Okay, so that's our details. So please follow us. We are quite active in our social media and we will release, the information there. The Facebook are particularly good because we do share a lot of public knowledge and public seminars there as well. So, and also IG and also Twitters and all the other websites. So please follow us. So my admission talk will end here. So next, I'd like to invite Paco. Paco is our E4 students during our program. He will come and share with us some of his journey through our 4E with us until today. So let's welcome Paco. Thank you.
So good morning, everyone. I'm Paco, a Year 4 pharmacy student in the University of Hong Kong. And today I'm going to share with you all some things and learning experience that I enjoyed the most as a HKU pharmacy student. So first, it's definitely the PBL, and I think some of you have already heard about it. So PBL is a learning activity that will be provided with different cases and scenarios, but only a few information about it is provided. Maybe one of an example is a patient visit your pharmacy and with symptoms of heartburn, and that's the question. And we need to act like detectives to ask for different important informations or clues to help us to find the most suitable products for the patients or a best treatment plan for him. And we love this activity because it's the first opportunity for us to apply the things that we have learned or theories in classroom to the real life situation. And it's a very rewarding process when we successfully solve these kind of mystery and successfully find the suitable products for the patients. And another activity is about the ward visit. And since our second year of study, we'll visit Queen Mary Hospital, which is our teaching hospital to work on different real patient cases. And through these experience, we will learn how to analyze and interpret different informations which can only be seen in a hospital setting. For example, how to analyze different consultation notes and what are the abbreviation means which is written on the bedside sheets from the wards. And these kind of knowledge and techniques will definitely be applied in our future career, especially when we have an opportunity to work in a hospital setting. And apart from learning activities, we all love these kind of practical experience too. So when we are start in the second year of study, we'll have the experiential learning, which we will work in different sectors a week a day. And in year 4, we also have our clerkship program, and we will work in 3 different sectors: pharmaceutical industry, community pharmacy, and hospital for 2 weeks each. And these kind of practical experience like allows us to have different hands-on experience and to see like what really is going on, what are the roles and responsibilities of pharmacists in different sectors. And this experience helps me to like find which part of the sectors is most suitable to me and to decide my future career pathway. And we can also learn different workplace specific soft skills. For example, I'm a year 4 student, and I've just been to Watson's in the past 2 weeks, and I've learned like what are the effective communication skills to communicate with the patients there in order to like empower them to have the knowledge about the medications and how to gather information and extract from them in order to help him or her to have the most suitable product. And yeah, we are HKU pharmacy students. Of course, we want to expose more to the healthcare field, but not only limit ourselves to pharmacy-related stuff. And but thanks to the department that we are in collaboration with many different companies, and our department will also launch different projects throughout the years. And since summer, I've been working as the student as partner with the departments to co-create an AI chatbot model for the pharmacy education, which will like develop different cases and scenario about the topics that we think it is difficult to learn and to manage, to help the junior year students to learn these kind of theories effectively. And I've also worked in the summer for the technological company called PharmCare to help them to optimize their healthcare mobile app and also to build a new pharmacy system. And it's a really good exposure. And I think like up to now, some of you may be already wondering that our university life as a HKU pharmacy student is so chur, always about studying, revising, and practicing. There's no any playtime when we are studying in here. And I'll be the myth breaker now and ensure all that no, that's not really the case. We have different activities to play and enjoy, and particularly I want to highlight those organized by our pharmacy society. So apart from the orientation day and orientation camp that I think most of you has already heard of, which are a platform for our junior students like to make friends and find their companions throughout the academic years here. And the photo on the right side is my group when I was a freshman. And we also have another activity called Superpass that we all anticipated. It's an activity before the exam period, and we pharmacy students will like come together and play different games, eat suckling pigs, and write fights to celebrate to hopes that we will score high grades in our coming exams. And apart from activities, we also enjoyed our relationship with teachers. So since year 1, we'll all have an academic advisor, which I would describe the relationship as they are like our allies and companions throughout the years of study here. Like when we encounter any study difficulties or any frustrations or concerns about a future career, we'll always turn up to them to ask for different support and guidance. And the relationship with us are like more than friends. Apart from hanging out with them occasionally, we'll also have an annual dinner, which is like another activity organized by the pharmacy society, which we will hang out and enjoy a wonderful evening. And here comes the most exciting activity, like I think throughout my four years of study here, is exchange opportunities. So during semester break, I have an opportunity to go to different places, top-notch universities to have an exchange experience. So in early June, I've been to Peking University and to have different site visits and to see how about the healthcare settings there. And it's a really amazing experience and really broadens my horizon to see like how technology can already applied in a pharmacy setting. Like when I just visit the Peking University Hospital's pharmacy, it's like the medications are flying around in the pharmacy everywhere with overhanging rails, robotic arms. And yeah, it's a really interesting experience. And we definitely treasure our leisure time to play, like visit the Temple of Heaven and also the Universal Studio Beijing. And the photo on the right side is not the School of Pharmacy in Peking University, but just a random shot inside the USBJ. And in August, we've also visited the University of Sydney, which I have been to. It's a 2-week exchange program. And back in there, we will have lectures, workshops, and even laboratories with the local students there. We have also different site visit experience too, which will see the pharmaceutical companies there, community pharmacies, and even hospitals. And we even have a morning to work and to have a hands-on experience in the local community pharmacy there. And we definitely played very hard there during our leisure time, not only doing some tourism, but also hanging out with the pharmacy society in there, which I believe is one of the happiest moments in my life. So my share is, I think my share is here, and I hope to see you all in the campus in the future. Thank you.